Did you know that according to the 2020 National Aphasia Association Awareness Survey says that 86.2% of people in the United States have never heard of the term aphasia? That's a pretty high percentage. Hi guys, my name is Viviana and I will be explaining what aphasia is, some of its causes, some of the treatments, and a brief summary. So imagine that you are creating coherent sentences in your mind, but when you speak them out loud, they're not what you thought. You're finding yourself having difficulty speaking or finding the correct or right words to say. You're speaking in short or incomplete sentences. Must be tough, right? This is the reality of many people living with aphasia. According to the National Aphasia Association, there are at least 2 million people in the United States with aphasia. So, what is aphasia? According to Dr. Lava in 2018, aphasia gets in the way of a person's ability to use or understand words, but it does not impair these person's intelligence. So let's go over what aphasia is in a medical aspect. According to the NIH, aphasia is a communication disorder that results from damages to portions of the brain, specifically the left side of the brain that is responsible for languages. So a person that has aphasia has difficulty speaking, understanding, difficulty reading, and difficulty writing. According to Medline Plus, aphasia is the loss of ability to understand or express spoken or written languages. People that have aphasia have a difficulty communicating their thoughts, their feelings, their ideas. People that have aphasia may have their communication skills disrupt, but that does not affect this person's ability of thinking. Let's take a look at the brain and where it affects. So this would be the left side of the brain, and it tells the Broca's area, which is the speech production area, the rhythmics area, which is the word recognition. Also behind is the posterior language area, and below that would be the perception and memories. That means the meanings of the words. So what causes aphasia? Aphasia is mostly caused by strokes or severe head injuries. It also may be developed slowly as a result of a tumor or a progressive neurological disease. It may also be caused by a brain infection, severe brain injury, cancer, epilepsy, gunshot wounds, or dementia such as Alzheimer. It is most common in older adults, specifically those who have had a stroke before. Unfortunately, there is no cure for aphasia, but there are multiple alternatives to treat aphasia. Some of the treatments for aphasia include speech and language rehabilitation or medication drug therapy. For speech and language rehabilitation and therapy, it is used by speech pathologists or speech therapists. These types of therapists helps patients regain the ability to communicate with others. So the therapist meets with the patient and teach them how to communicate without using any kind of speech, helping them compensate for the language disability that they have due to aphasia. Also, therapy aims to improve the ability to communicate, to restore language ability, and to learn other ways of communications, such as drawings, pictures, gestures, or facial expressions. In summary, aphasia is a loss of the ability to communicate with others. It is mainly caused by strokes or severe brain injury, and some of the treatments include speech therapy and medication drug. Although medication drug improve blood flow through the brain and enhance the brain's recovery ability or improve the depleted chemicals to the brain cells, it requires more research for these types of medication therapy to work. Unlike speech therapy language, which helps a patient with aphasia be treated more effectively. So no one is prepared to suffer or see a loved one suffer or struggle with aphasia and having difficulties to communicate effectively with others. So I hope that after these presentations, we are more prepared to identify, understand, and become more aware of communication difficulties. And I hope you do not forget what you have learned today. Thank you.